Assalamualaikum everyone. My name is Rubad. I'm a fourth year medical student from Rafa. This is my presentation, Budding Medical Professionals and COVID-19, the impact of COVID-19 on mental health and medical students. As you all know, COVID-19 was introduced in December 2019. And since then, there have been several changes worldwide. One such impact was on the education system. Countries such as North America, Europe, they're more quickly adapted to the situation as compared to Pakistan. And that's where we conducted our study on. We wanted to assess, analyze medical students in regards to their impact on education and mental health due to the COVID-19 pandemic. Since lower middle income countries such as Pakistan and India, they had insufficient resources, and it took a longer span of time to develop a system which was more effective in terms of education. So moving on. The ethical approval was obtained from the Rafa International Medical College. The inclusion criteria was medical students who were more than 18 years of age, enrolled in any health-related field, which was dentistry, pharmacy, nursing, and MBBS, and studying within Pakistan. The exclusion criteria was anyone less than 18 years of age, not enrolled in any health-related field, and studying outside of Pakistan. So in order to, due to the COVID-19 pandemic, the best method for the study design was adopted as a cross-section study. It was conducted between October 6th and December 28th, 2020. It was an electronic survey consisting of 20 questions. In the questionnaire, a 5-point Likert scale was implemented. Depression and anxiety among the target population was gauged using the patient health questionnaire and coronavirus anxiety scale. In the patient health questionnaire, a score of 1 to 4 translated as none, 5 to 9 was mild, 10 to 14 was moderate, and 15 to 19 was moderately severe, and whereas 20 to 27 was considered as severe. In the corona and virus anxiety scale, cutoff score of equal to or greater than 9 was used to classify between no anxiety and anxiety. The total sample size was calculated to be 600 using the software RAUSoft with a 95% confidence interval. The sample size was increased to 56% to count for non-responders. Descriptive analysis was conducted using frequency and percentages. In the final analysis, depression was classified into binary value, such as yes or no. Univariate analysis was conducted to compare each impact of each variable with interest to COVID-19, related anxiety and depression with each variable of interest. Again, a p-value less than 0.05 was considered significant, and data analysis was conducted using the software data. So looking at briefly at the diagram over here, which I've inserted, we asked the participants how were their feelings of stress regarding COVID-19 before the pandemic started and during the pandemic. As you can see from the diagrams, in the first bar over here in the red portion, only 4% of the students indicated feelings of stress before COVID-19, and during October 2020, when this study was conducted, 13% of the students said they were feeling stressed. In order to get a better understanding of the factors that were impacting the students, we looked at different academic and everyday lifestyle difficulties, and these included such as the inability to focus and complete academic work, difficulty with online mode of learning, inadequate Wi-Fi or computer access, and whereas 16.2% of students they said they have no academic difficulties. Other things we analyzed was that some students they said they have inadequate financial aid, and some students said they have transportation issues during this pandemic. Looking at the bottom half of the table, we also wanted to analyze the mental health, and over here we looked at the anxiety, the level of concern with COVID-19 pandemic, and the mental health burden. Whereas over here you can see that 66.2% of the students said they were ready to extremely concerned, and the mental health burden was divided into different factors: depression, anxiety, and somatization stress. Again, for this, a brief symptom inventory scale of a BSI was conducted, and these are the values as follows. And they were conducted in standard deviations. So the results from the patient health questionnaire and the COVID anxiety scale were as follows. About 22% of the students, they said they reported as depression, whereas 10% of the students, according to COVID anxiety scale, they said they have anxiety. So in order to get a better understanding of the different factors that were involved, we looked at the different parameters. We conducted a different multivariable analysis. And over here, what we analyzed was that COVID-19, it was associated with gender. Males, they were more or less likely to be considered to be going under depression as compared to females. Students who had a steady family income during this pandemic, they were more or less likely to experience anxiety. And another thing, who students who were willing to visit hospitals during COVID-19, they were at the less likelihood of experiencing anxiety and depression. So these are like just a bunch of factors which we wanted to analyze. Moving on to the conclusion, COVID-19 pandemic is making a significant impact negative impact on mental health of medical students. Proactive efforts to support the mental health and well-being of students are needed. Academic difficulties such as ability to focus on academic work is significantly associated with increased levels of depression, anxiety, somatization, and stress. The institution should conduct seminars regarding mental health to help students with cope stress and depression. The government can also come to play as to provide students with financial aid loans and with low interest rates, along with other student discounts on transport, study materials, and study materials. Yeah, that was my presentation. Thank you for listening.
Thank you very much for sharing this information, Rubaid. Moving on to the next presentation, I would like to call Mr. Inzamam from Fazaya Medical College to present his topic on assessment of nutritional status in children attending government schools in Islamabad.
Distinguished guests and speakers, Assalamu alaikum. My name is Muhammad Inzamam Khalil from Pioneer Batch of Fazaya Medical College. I am very thankful to Rifa International University for providing me a platform to present my research, and very thankful to university for organizing conference on lifestyle medicine, which is very important nowadays. But now, which is a very important factor in nowadays. My topic of presentation is assessment of nutritional status in children attending government schools in Islamabad. Health is often recognized as a basic pillar for social and economical progress of a country. In Pakistan, we have a quite large number of child malnutrition. In a study conducted in 2016, 155 million children were found to be stunted, and almost half of deaths under 5 years of age of children were due to the malnutrition. According to National Nutrition Survey conducted, which was in 2011, 43% of children were found to be stunted and 15% were wasted. Various aims and objectives include to assess the nutritional status of children going to government schools in Islamabad. Various objectives include to determine the proportion of underweight and stunted children in study population, and to determine the association between mother's education and nutritional status of a child. We use descriptive cross-sectional study design. Study population includes students from 6 to 12 years of age from 1st to 5th grade attending Islam IMCB F11-1. Various operational definitions include BMI, underweight, healthy, overweight, and obese child, stunted child. Our sample size was calculated to be 80, and we use simple random sampling method, various data collection tools which we used, and we used SPSS software version 23 for data analysis. In our study, we found that 23 out of 80 children in our study design, in our study population, were found to be underweight. And in height for age of child, we found 12 children stunted out of 80, which is of 15%. In BMI category, in comparison, there were certain children who were who were appearing to be healthy on BMI category, but when we do height for age of the child, in comparison, we also found that 6 who were appearing healthy on BMI category, they were also stunted. In comparison with education of mother and education of mother to the health of child, we found that 35 and 32, these all whose mothers were educated up till primary, they were found to be stunted. Shorter height of, in our result, we found that shorter height of children may mask their poor nutrition status and rule out as healthy on BMI scale for children. And various economical, political, and social changes should be made with special focus on mothers' education to improve the nutritional status of children. Various recommendations which should be done include the mother's education for nutritional importance of child, parental education, proper food care of child, and government should provide subsidized food to poor people. That's all. Thank you.
Thank you very much. I have an important announcement to make. I request all of you to have lunch, except chairperson, co-chairperson, evaluators, and presenters, as we are running short of time. So all of you can go for lunch for 20 minutes and come back after that.